Okay, so when I left off yesterday, we were talking about um, IV induction to intubation. And again, this doesn't done a lot um, in the cow, in the adult cow. Like most things are standing sedation, local anesthesia. But if they are going to be induced and intubated, there is a different process than the horse. Similar size tubes, so the large, longer tubes. The one thing that you do need for a cow that you didn't need for a horse is you're going to need a stylet if you're going to be using for a calf or like a goat or a sheep, because it helps keep the tube rigid and it helps with the technique. And you do need some type of mouth gag to hold their mouth open. There's nobody really that's going to be, I mean, their head is so large and heavy. Trying to lift up their head and hold their mouth open is going to be near impossible. So you would need to have a mouth gag, kind of the kind that has a crank, because their mouth doesn't open very wide on their own. And then if you're with a small ruminant, you're going to use a laryngoscope. And again, we talked in horses, you don't use laryngoscope. You don't need the stylet. Probably going to need some gauze because they make a lot of saliva. The tongue is slippery. And probably longer forceps or suction, because the suction is going to be needed because they produce a lot of saliva. The long forceps, there's something called an instrument called sponge forceps, and they're very long and curved, and usually you kind of put a wad or a stack of gauze and you clamp them, and so you can wipe in the back of their throat. So some people will do that with suction, some people will just do the sponge forceps, but you need something. So I do want you to know for the test what's different in the process of intubation. The other thing now with the small ruminants and calves, so we'll start with that. Well, both their tongue is very, very thick, and especially in the back, it makes the airway a little bit harder to see. And the stylet is going to help place the tube, and it's a different technique than putting a stylet in a cat tube. Actually, let me show the pictures because it makes more sense. So what you're going to do, in here we have a calf, is now this person, I know it looks strange, they're holding on to the nostrils. Sometimes what you can do is put like a rope around their teeth and hold the rope open, but you have to put the laryngoscope pretty far back. And what they do in this second picture, and this is what's not normal, is they're going to put the stylet through the tube where it comes out the other end. Remember, in a cat, you never want the end of the stylet going past the tube because you don't want to cause any lacerations. Well, this stylet that you use is going to be blunt on the end. It's not sharp. But what you're going to want to do is put the stylet through the larynx, through the vocal cord opening, and then you're going to thread the tube down the stylet. It's almost like when you put a catheter in a vein, you put the needle, the needle part in, and then you thread the catheter into the vein and the stylet comes out. It's kind of the same theory, is the stylet goes in the airway first, and then you're going to slide the endo, and you can see the endotracheal tube has been slid down. And so again, because it's difficult to see and it's difficult to do, the stylet technique makes it a little bit easier. Now, if we're talking about adult cattle, now first of all, remember, cows are sternal. It is blind, but it is blind by feel. So what you're going to do, and here's the procedure, but let me kind of explain with the picture. So here's that large mouth gag. It's put in between, right by the canines, and they kind of crank that open, and with your so I'm right-handed, so my non-dominant hand is my left. I would pull the tongue, someone holds the tongue to the side. I'm going to reach in the back of their mouth, and I'm going to feel for the larynx. I'm going to feel for the epiglottis. And then you're going to take the endotracheal tube with your dominant hand, and you're going to slide it to your hand and underneath and into the larynx. So it's blind because you can't, it's very hard to visualize their larynx, but you can feel it. So horses are blind, but you don't feel, you just pass it in there and it usually goes in. In a cow, it's blind by feel, and you have to touch the larynx and slide the tube under your hand. And the same way, you don't have to feel for placement because of their long neck. You're going to have somebody push on the chest, or when they breathe, you're going to put your hand in front of the tube and feel for air. Because again, you're not visualizing it, and hopefully if you feel it, you know it went in the right spot. But the only way to guarantee is to feel for air coming out of the tube. So that's how you confirm. And basically, when you open this, this is when you would maybe take the suction and go ahead and suction back here, take your forceps, clean out their mouth, and then, you know, try to remove as much debris, any little feed that gets stuck. You don't usually wash out their mouths like you do with horses, although you can. But because you're going to have suction, you can usually suction material, use the sponge forceps to clean back there. I've even, sometimes cats make a little excess saliva. I've sometimes even taken little hemostats and crimped some gauze, and I wipe the back of their mouth, or I've used Q-tips to clean in the back of their mouth. So if any animal that I go and intubate, if they have a lot of saliva, I try to get some of that out beforehand if I can. But with these guys, you're going to want suction or something for sure. So basically, these are the steps, is that, you know, you've got your non-dominant hand and you palpate the larynx and you advance the tube, and then you're going to inflate the cuff. You're going to take out the mouth gag, and then you're going to tie the tube to their halter. You know, so usually they'll probably have a halter on of some sort, a rope halter, or something of that nature. And again, when you maintain small ruminants and calves, you can use the small animal machine, and you can maintain them with ISO or SIBO. And adult cattle are similar to horses, is they basically tend to hypoventilate, and it says place on a ventilator if necessary. Most of the time they're going to just put them on a ventilator because it's very hard to bag them manually because of the large bag, and they do hypoventilate, large weight on the diaphragm, and so it makes it a little bit harder. If you're going to just do intravenous maintenance, where you're not going to maintain them on gas, you're going to keep them asleep. This is only recommended if the procedure is going to be fairly short. You can also, if you have an intubated patient and you want to lower your gas, you can always run some intravenous anesthesia during general anesthesia. And again, the double drip is the common intravenous mix that is used in cattle. So it's basically without the xylazine. Triple drip in the horse, and double drip is just taking out the xylazine. And then you can use that in small increments intravenously. And again, anytime you have an animal that large, and I talked about this with horses, if you need to turn them up because they're light, if you need to turn them down because they're deep, you know, the gas anesthesias are very quick induction, quick recovery, but in a larger animal, it's going to take longer to change planes of anesthesia. So sometimes it's always going to be beneficial, especially if an animal gets light. If an animal gets light and starts moving, there is times you have to give extra intravenous agent because it's going to take maybe 10 minutes or more for them to get deeper by turning up the vaporizer. You know, a dog and a cat, you can turn up the vaporizer and they're going to get deeper faster. They're a smaller patient. And so you always want to have some of that intravenous agent if need be. As far as positioning, they still need to be well padded. We do worry about myopathy and neuropathy. So the same principles apply. You don't want to cross their legs. You don't want to overextend their legs. If they're on a halter, you might want to have a padding in between so they're not putting pressure on the facial nerves. So you always have to think about padding. You always have to think about blood flow, so keeping good blood pressure. The same principles as monitoring applies. Monitoring your CO2, monitoring blood pressure to maintain perfusion. But the other thing you want to do is try to put their mouth lower than their pharynx. So we usually try to tip the head, and that helps any saliva or potentially regurgitated. Remember, they're prone to regurgitation because anesthesia relaxes the rumen, and some of that rumen fluid can make it up the airway, and this will help it drain. Again, you're probably going to still have suction, and if you see some of that come out, you can always suction them during anesthesia. I've done that in small animals where we've got an animal that has regurgitated fluid. A lot of times before I wake them up, I take suction and I suction the back of their throat so that when we wake them up, hopefully they don't aspirate that fluid that's in the back. Now, a lot of times, here's a picture of a cow on the tilt table. Now, this tilt table has a little bit of padding. The head is typically tied. Now, there's not a lot of other padding, but again, when they're on the tilt table for something that's maybe less than 20, 30 minutes, you probably don't need as much padding. But what you can see is where they do tie the legs, there is a padding in between that joint. Because again, you don't want to have a chain or a tie directly on the leg and causing any kind of neuropathy. That's kind of what we worry about with these guys. As far as recovery, they're actually much nicer to recover than a horse because they are kind of okay being relaxed. They're okay laying down. They still need to be in a padded stall. And if you're in a farm, they need to be on some hay. You don't want them, again, laying on hard surfaces if possible. You do try to keep them in sternal for recovery. So whenever you position them, you really don't want them laying on their side. So that, a horse is going to recover in lateral, and usually they'll move themselves up to sternal. But in a cow, you want to start them in sternal. So sternal for induction, sternal for recovery is what is needed. And part of that is because you don't want to put pressure on the wrong side of the rumen or the other chambers of the stomach, because that can predispose them to bloat. So if they're sternal, we have good, hopefully, they're going to still be able to pass gas or eructate, and there's not excess pressure causing regurgitation. So a lot of that positioning in sternal is due to their GI physiology and making sure that is functioning. Do want to keep their head lower if you can while they're recovering, and definitely want to look for bloating. So we're not really looking for colic, but remember, what side did I tell you to watch on the cow very closely? Which side do we want to monitor the rumen?
The left side?
Yes. So the rumen occupies the left side of the abdomen, and not that the other chambers don't bloat, but you're really concerned about rumen bloating. Is there an obstruction with feed material? Gas is continuously produced the entire time, and they have to be able to relieve that gas. So you do want to look for any abnormal swelling on the left side. Now, one thing that's also different is normally I've told you guys on recovery of most patients, usually after I turn off the anesthetic, and I turn off the oxygen, because I usually try to give 5 minutes of oxygen after I turn off the anesthetic. Hopefully they don't wake up too fast. Normally you deflate the cuff before you pull the endotracheal tube. In these guys, you're going to want to leave the cuff partially inflated. So when you pull it, you're going to just take out a little bit of the air. The theory is if anything did get into the back of their trachea, as you pull the tube out, it'll pull some of those potentially regurgitated fluid or stomach contents. It'll pull that out with the tube. I have done this occasionally in small animal. If we have an animal, say, that vomited on recovery, if we have an animal that had a lot of regurgitation, sometimes if we do surgery on the tongue or the throat and they have a lot of blood in the back of their throat, there are some cases in small animal where I do leave air in the cuff and I pull, could it potentially cause some tracheal irritation? It could. You're not pulling it full. It's partially deflated, but it is more beneficial to try and pull anything that did migrate into the back of the trachea. The cuff will kind of pull it out with it. Is the theory. So partially inflated cuff, and you want to wait till they're really swallowing. Potentially when they're beginning to cough, when they're swallowing and starting to cough, those are signs that they're getting their laryngeal reflexes back. That's they're getting their swallow reflexes. Hopefully they're blinking. Hopefully they're showing some movement. And that's what we look for. Now, if we're talking about, if you try, this can happen. If you didn't take enough air out of the tube, if you can't pull it out. Now, remember, I've told you, you should never, okay, first of all, filling the cuff does not hold the tube in place. It should never be so tight that you can't pull that tube, because there's been plenty of times in an emergency where if I've had to pull a tube because an animal starts chewing, and sometimes you don't have time to deflate the cuff. Again, I'd rather cause some tracheal irritation than have an animal bite a tube in half and have to go back in potentially surgically or emergency and pull a tube that's been bit. So in those situations, yes, it's not ideal to have to pull a full tube, a full cuff. But if you have time and you try to pull it, you can take a little more air out to make it a little bit easier. Now, if they can maintain sternal recumbency on their own, you can leave them on their own. Sometimes people are standing next to them with their legs kind of propping them up, but hopefully the animal can maintain their own sternal recumbency, and we don't need to withhold food or water. So normally you can just put them back in their stall and they can eat and drink, but they do wake up a lot slower. So it isn't as much of an issue. So if you can see, here we have a cow and we've got somebody sitting here with their legs kind of, if you can see in this picture, he's got his knees against the chest, and usually sometimes the front legs are kind of bent underneath. And basically sternal recumbency, and this allows, again, someone's monitoring to make sure they can eructate, which is burp, and that the nose is tipped down, so you've got drainage of saliva, and the legs are help keeping her sternal. You can put positioning devices and things like that, but you don't really want to walk away from them until, and normally you can be in the stall with them. It's not like, a horse is very dangerous when they wake up. A cow is pretty slow. So most of the time, unless it was aggressive, normally they wake up slow enough that you can sit in there with them, make sure they're burping, make sure they're sternal, make sure that saliva is draining, make sure they're breathing okay. Always make sure they're breathing okay. So once they're in sternal, And once danger of bloating is passed, if they're hearing eructation, there's less of a chance they're going to bloat, which means they're relieving their gas. We only worry if you're sitting with a cow and you hear no burping, you smell no gas. I would be a little more worried that that cow would potentially bloat. But once they're sternal and they're burping and you're not worried about any bloating, you usually can leave them alone. The only problem with cows, I will say, is sometimes they don't want to get up. It's kind of the opposite of a horse. You might go back in there and they're looking around and they're obviously very awake and they're just kind of stubborn and laying there. So sometimes you got to go in and kind of nudge them and hit them. And sometimes we do, I don't know if you've talked about the tail jack technique, but sometimes you take their tail and you actually kind of really bend it against their body. That's kind of a way you can kind of steer them and get them to move. So sometimes you go back, you do the tail jack, you kind of push, you nudge them, and sometimes people are really smacking them hard. And I mean, trust me, they're tough. They're not, nobody's hurting them, but sometimes you have to be somewhat aggressive because you do worry if they won't get up, because again, their legs are folded under them. We do worry about, is there any nerve damage? Is there myopathy? But the longer they're laying on their limbs, that potentially is going to be a problem. And again, usually they can have food and water unless you did a special surgery. There's always the chance the doctor may not choose to give them food or water, but you always check with the doctor to make sure. In most procedures, they can eat and drink by the time they get up and start moving around. Are there any questions about cows or cattle? So I think I've highlighted their key differences from a horse. Even though they're the same height, most cattle and horses can be similar in size. They are definitely treated differently because they have different, physiology, different behavior characteristics. I'm only going to say a few things about camelids or llamas and alpacas because they are becoming more popular. We did see some llamas and alpacas when I was at Purdue. They are not a true ruminant. The first stomach is similar to the rumen, but what they do have in common is they produce a lot of saliva. So again, making sure that they're always breathing okay, making sure there's suction, making sure their nasal cavity is clear. The one thing I remember about llamas, it's like, don't stare at them. If they start staring at you and they start putting their ears back and they start moving their lips, they're about to spit at you. I got to help with one at Purdue, and we had a thing called the foal unit at Purdue. And if we had, it was like a treatment room, and the foal would be out on a mat, except this was a baby llama. And then we had a stall, and the mother, because mares do not like to be separated from their foals, they get very aggressive. So if their foal was in the foal unit, we had a stall in the room. So the mother, and quite often the mare, she would be putting her head over and looking at us and smelling her foal. So she had to be able to see her foal and access her foal. But we had the mama llama, that's fine. So I was sitting with the llama, the baby llama. We were doing treatments and monitoring, and I turn around and the llama, she's like stretching her neck out, staring at me. And it's kind of like when someone tells you not to stare at something, I was almost wanting to stare more. I'm like, it's going to be fine. And I couldn't look away from her. But all of a sudden I see her doing her lip thing and I was like, okay, turn away. And because she was a little aggressive and she did like to spit at people. So when you're out there next week, don't stare them down. Now they have some cow and horse characteristics. They are obligate nasal breathers like a horse. So you have to worry about airway obstruction. If you notice that their nostrils are excessively flaring, if you notice abdominal breathing, if you notice a lot of nasal discharge, we have to be cautious. They are prone to developing nasal congestion in certain positions. And that's, basically like secretions start to gravitate to the nasal cavity and can build up. But if an animal can't breathe, if it's an obligate nasal breather and something is obstructing the nasal cavity, how do I know? What is going to clue me in? Something's going to change about their color, their effort, their rate. That's the only way I can monitor to know there's a problem. Now, as far as you kind of anesthetize them like small ruminants, typically they can do the IV catheter. So their skin is a little bit tougher. It can be more challenging to place the IV, and they've got that long neck. As far as, they can be aggressive. And you may have to do some pretty heavy sedation before the catheter, before moving them into the induction area. So usually though, because they're smaller, they don't necessarily have to be on a ventilator. You can ventilate them. They don't have as big of a thorax, as much weight on their diaphragm, so they don't necessarily need mechanical ventilation. They can have some more variability. Horses and cows' heart rate is naturally slow. Remember, heart rates, the bigger they are, the slower it is. We're talking in the 30s, 40s, maybe up to 50. That's kind of high for a horse. These guys are going to be a little bit more unpredictable. But again, if it becomes too slow and the doctor's concerned, you're going to treat with an anticholinergic, atropine or glycopyrrolate, both. Now remember the difference. We haven't talked about this in a little bit. Atropine and glycopyrrolate are both anticholinergics. Both are good to dry up salivary secretions, although glycopyrrolate is better. But in an emergency, a bradycardic emergency, or like cardiac arrest, atropine is the drug of choice. It's going to increase the heart rate much faster. Glycopyrrolate can raise the heart rate, but it doesn't raise it as much. I like glycopyrrolate for animals I don't want to because I've had some animals I've given atropine to and their heart rate speeds up way too fast. It does wear off. But I liked glyco because it raised it a little bit, but didn't I'm going to just be frank, it didn't jack it up like so fast. But in an emergency where you really need a drug to respond, atropine is still the gold standard. So that's kind of the difference when we lectured. What's the difference? And glycopyrrolate's more expensive. So maybe might not be using much glycopyrrolate. I really liked it. But in an emergency situation, I'm going for atropine. So may have to treat that. And these guys, you have to be very careful when you are laying them down, moving them. Somebody is always supporting the head and neck, because when they're anesthetized and everything is relaxed, that big flexible neck, we don't want to cause any injuries to the neck, to the head. So somebody really needs to kind of be always paying attention to the head and neck. And they have a very prominent eye similar to a horse. So you just want to have that maybe covered or protected. And then you're going to try to be cautious for the saliva and regurgitated fluid. When you do wake them up, they tend to be insternal, and kind of the difference is you need someone holding the head upright. So if we look at this picture, here's one recovering. They've shaved the neck for the catheters, keeping them insternal, and they have a hold of the fur on the back of their neck, and that's going to help. So in this situation, any regurgitated fluid or saliva is going to drain down. Hopefully, you've got this well um, positioned so that it'll drain to the back of the throat, hopefully down into the esophagus. Um, Now, if they are labored breathing, if we are worried, you can give oxygen via a face mask because they're smaller. You can use just a large face mask hooked up to an oxygen line. And if they're really dyspneic, you can put in the nasal tubes. So if I go to this picture, here is one recovering, and it has actually bilateral nasopharyngeal tubes. So like I talked about in a horse, if they had difficulty breathing, low oxygen, a nasopharyngeal tube is going to be able to maintain an airway. And even if they're chewing, you can keep it in longer. So, and it's kind of hard to see probably in this picture for you guys, but there is, you can see some nasal discharge here and here. So, so again, these nasopharyngeal tubes, if you're noticing excessive flaring of the nostrils, if you've noticed that there was a lot of discharge, then you can go ahead and place these nasopharyngeal tubes. And the same theories apply. The only thing with these guys, and even if they're aggressive, is someone needs to stay with them until they can keep themselves sternal, but mostly till they can keep up their head and neck, because you don't want them flopping or falling into an abnormal position and hurting their neck. So you can stay in the stall and hold them until you can kind of feel that they start to control themselves, and then you can move away. So are there any questions about llamas, alpacas? Okay.